Hey guys, as you may already know, good oral health is an important part of good overall health, and it becomes even more important during pregnancy. Each year, more than 6 million women in the United States become pregnant. We as dentists were more than happy to see you guys for your preventative, routine, and emergency dental care while you're pregnant. In my practice, I typically see about 1 or 2 pregnant patients a month, and it's always exciting to see them because not only they're helping themselves, they're actually indirectly helping their baby. And I will explain this in a little bit. The reason I wanted to make this video is because at the moment with the pandemic, we have limited access to our dentist, and also preventative and routine care might be delayed. So I wanted to kind of share with you guys a few things that can happen, some of the changes that can happen with your oral health during pregnancy, and also give you guys some good tips that you can benefit from by implementing it and improving your oral health in general. So let's get started. With pregnancy, with the hormonal changes that you will experience, usually typically around the 2nd month of your pregnancy, you might start to get gingivitis. And what is gingivitis? Is basically early infection of the gums. You may start to see your gums bleeding, they're a little bit red, puffy, irritated, and when you brush or floss, they might bleed. And if gingivitis goes untreated, it can affect the underlying structures that hold our teeth and compromise them. So the best thing is to call your dentist and kind of consult with him about this. The next thing that can happen while you're pregnant is that you may start to have some lumps around the gum lines or between the teeth. These raw looking red mulberry-like bumps can be painful and tender. They typically go away after childbirth, so they should go away. If it doesn't, contact your dentist. And because they're very irritating and uncomfortable, it might bother you when you're brushing or flossing. In some occasions, you may have to ask your dentist to remove them. One more thing that usually happens with pregnancy is the changes in your diet. So typically, you start to snack a little bit more during the day. So we know with snacking more frequently during the day, you can increase the chances of getting decay. So let's talk about some of the techniques and things that you can do at the house to prevent getting cavities and maintain a good oral health. The first thing we want to focus on, and before I go to that, is I want to share with you guys one of the studies I found from University of Michigan, where I went to school, and they did a research a long time ago, many years ago, and they found out that by brushing, you can improve your gingivitis. So basically, you can reduce your gingivitis by thoroughly brushing. So let's talk about brushing. I want you guys to brush twice a day for 2 minutes using a fluoride toothpaste, and you have to brush thoroughly. So remember, we're at a time where with the pandemic, you might not be able to go for your routine checkup. So thoroughly brushing twice a day for 2 minutes can actually reduce your gingivitis. The next thing would be flossing. So I want you guys to floss at least once a day, utilizing the C-shape techniques, which I will show you guys in my future videos. The next thing would be diet and snacking frequently. So snacking frequently, we know that it causes decay. The decay is caused by the plaque. And plaque is a sticky film of bacteria that attaches to our teeth. And if it's not disturbed by brushing or flossing, it causes cavities. This bacteria that lives in the plaque converts the sweet stuff, the sugar and the starch that we eat, to an acid. And the acid attacks our teeth. So the more frequently we snack and the food that remains in our mouth it can change to an acid, and then that acid attacks our teeth and causes decay. So the best thing is to, again, disturb this plaque, brush and floss. The exciting part that I was going to talk to you guys that makes me excited when I see my pregnant patients coming in for their routine dental checkup is why it indirectly affects their baby is that the healthier the mom is as far as her oral health, the less bacteria she has in her mouth. So when the newborn comes and the mom is feeding the newborn, the less bacteria she has in her mouth, because you know sometimes mom want to taste the food with the spoon, or they want to make sure the temperature is you know, proper, so it's not going to burn the newborn. They place the spoon in their mouth and they taste it, or they check the temperature, and then they place it inside the newborn's mouth. By doing that, the mom is transmitting bacteria from her mouth to the baby's basically mouth. So the healthier the mom's oral health is, the lesser bacteria, the volume of bacteria that lives in her mouth, and also the less aggressive bacteria that live in her mouth are getting transmitted to the newborn. So that research has shown that that can reduce the early childhood cavities and decay. So basically, the child will have a better prospect of not getting cavities early in life and also later on in life. So it kind of goes, you know, it's a relationship that goes maybe many years. I hope you guys enjoyed this video and the tips that, you know, that I shared with you guys. Share this with your friends, subscribe to my channel, like my video, and I'll, you know, share with you guys more good tips that can help you protect your teeth and protect your smile.